seeing the heartbeat and doing the ultrasound, it was so amazing. I just remember telling the nurse at the time, there's a baby in there. After trying for a few years, we realized that it was kind of started leaning towards male factor infertility. And so that was whenever we decided to treat my husband's issue, which is the varicocele repair. So the urologist did varicocele repair surgery in January of 2015. And so we were gonna do a surgery, we were gonna fix that, and then boom, we'd be pregnant and it would be so great. And that's kind of where our train derailed. And he went in for an MRI thinking it was a pinched nerve or a slipped disc, something easy. And the doctor came back and said, it's not. It looks like there's something in your back. Doesn't look correct. Looks like it's some form of cancer. I don't know what else it could be. I'm gonna hand you over to an oncologist. They told us it was Hodgkin's lymphoma, which my general practitioner at the time told me, you know, of all the things to get, that's the best one because it is curable. There is a standard treatment plan and all of that. We ended up banking a sample, I think 2 samples actually, at that time, and just figured, you know, whenever we get a little further down this road, we know that he's okay, we'll go ahead and proceed with whatever treatment that looks like. And I found out that both samples were not viable. He got his first PET scan along the way to make sure that it was actually working. We were thrilled. That was only 2 months in, so that was around July of 2015. And in August of 2015, I thought, well, you know, we're gonna be done with all this in November. I wanna go ahead and talk to this Dallas IVF facility. I wanna talk to Dr. Havman, and I wanna get a game plan. Like, let's figure out where to go. So we're ready to hit the ground running.
The best treatment plan for Nikki and Dee would be to proceed with IVF and ICSI. Given the treatments that Dee underwent, including chemotherapy and radiation for his cancers, those can affect the sperm development, and in females undergoing chemotherapy and radiation, that can affect their eggs. Given this circumstance, IVF was the best fix for them, as we can take and stimulate Nikki's ovaries, retrieve the eggs, and then hand select through the ICSI process one sperm and directly put it into each egg. The ICSI process then allows us to hand select one sperm for one egg, allowing fertilization with less quantity of sperm and or less quality, making ICSI a viable treatment plan for patients that have male factor infertility from all sorts of different causes.
We came in early August and we did a transfer, a fresh transfer. And at the time we had one other one that was looking pretty good, but they weren't gonna transfer because of my age and health. Everything was good. We felt really good about transferring the one. So we did the transfer in early August. The next day they called and said, hey, your one that was looking really good actually is hatching. We're gonna freeze it, so you have one frozen. But I really felt good about the transfer, and I just felt a little bit like it worked. And so officially on November 14th, I went to Dr. Havman's office and we did the blood work, and we had a positive pregnancy test. And 2 days later, our numbers more than doubled, and we could not have been happier. We were, there are no words. Those are happy tears now. We really wanted to not let cancer get to dictate our lives. For the past year at that point, it had stopped everything for us. We had just moved into our new house within a month of finding out he had it, so it really got to dictate our whole lives. And my husband was just tired of it, and I was tired of it, and he wanted something else to look forward to. Ironically, whenever we started IVF was July of 2016, and now we're due with our first baby July 22nd of 2017.